Welcome. Today we're going to review optimal techniques, and what we're going to look at are the radiographic factors necessary in creating images of diagnostic quality. So let's get started. The first factor we're going to look at is kilovoltage. kVp controls contrast, and it also affects density. And it does this because kVp controls the quality or the penetrability of the X-ray beam. On the other hand, milliamperage, or mA, controls radiographic density. And it does this by controlling the amount of X-ray photons that are produced. The exposure index is a control that you can use to up or lower your density. Time is an exposure factor that controls density and affects recorded detail. Time plus mA gives you mass, which is the controlling factor of density. Let's explore optimizing image detail, and we're going to do this by looking at the geometric properties. First on our list is SID. SID stands for source image distance. Now, how does this relate to detail? Well, as SID increases, unsharpness decreases and recorded detail increases. Also, an increase in SID will decrease size distortion or magnification. Now, when it comes to OID, or object image distance, the relationship with detail is as follows. An increase in OID increases unsharpness, which decreases recorded detail. Also, an increase in OID will increase size distortion or magnification. Focal spot size, FSS, also has a relationship with detail. As focal spot size increases, recorded detail decreases and unsharpness increases. AEC, or automatic exposure control, controls density by determining the length of the radiation reaching the image receptor. Chambers on the Bucky shut off the exposure when enough radiation is received, so remember to center the area of interest over the appropriate chamber. Visibility of structures. You need to optimize your contrast for good visibility, which means using the correct kVp. You need to utilize grids to control scatter, and you also need to minimize motion. Getting rid of those two artifacts increases visibility. Did I mention grids? Well, a grid is a device that absorbs low-energy X-ray photons. There are a couple of basic types. There's a parallel grid, a crossed grid, and a focused grid. The correct usage of a grid will improve contrast, and it does this by reducing the scatter deposited on the image. But it does this at an increased patient dose, so grids should not be used on body parts unless they're 10 centimeters or larger. But with grids also can come some errors, and those are in the form of an off-level grid, or an off-centered grid, or an off-focused grid, or even an upside-down grid. And all of these grid errors that you see here, they cause grid cutoff, which degrades the image terribly. But even more importantly than that, these are all operator error. There's no reason for it to happen, and generally it only happens once and then never again.